Hello, Bell's Palsy here. Today I would like to talk to you about Ramsay-Hunt syndrome symptoms. So Ramsay-Hunt syndrome is the ugly stepbrother of Bell's palsy, if you will. It is the second most common type of facial paralysis. And it is actually quite different than Bell's palsy, even though some of the symptoms can be very similar at first. There's some unique symptoms to Ramsay-Hunt. Ramsay-Hunt syndrome is caused by the varicella shingle virus, the one that you have with chickenpox. And basically, you could say that that facial paralysis and that acute condition with the facial nerve is basically just like having shingles on your face instead of some other part of your body. So if you had shingles, you know that's very painful, and that could be the case with Ramsay-Hunt syndrome. So what you should be looking for are the following symptoms. So extreme pain in your face, in your hair, by your hair, around your hair, in your jaw, your neck, anywhere on one side of your face. This is a trademark, and it can happen sometimes before or after the facial paralysis has started. So if you do really experience quite a bit of pain, which is fairly uncommon to experience severe pain with Bell's palsy. So if you do have a lot of pain, I would always question and make sure that Ramsay-Hunt is actually ruled out before you continue with any other kind of treatment. You might have to go back to the doctor, and they might have to change your medication, as well as it would also change your facial exercise and physio regimen as well. The second most common symptoms, or actually that's a trademark of Ramsay-Hunt syndrome, is little blisters or rash that will show up inside your hair, around your hair. They can happen really anywhere on your face, but they are most common in the hair. They could be on your neck as well, and also quite often inside your mouth. So if you look in the mirror, it might be on top of your palate or in your inner lip and other places. So they are little vesicles, that's what they are called, and they're just little blisters. And what makes it difficult is sometimes those blisters, you can have Ramsay-Hunt syndromes with or without that symptoms, and that's the difficulty of sometimes the diagnosis of Ramsay-Hunt is that it doesn't look quite very much different than Bell's palsy in the beginning. So. Two other symptoms that you will maybe experience with Ramsay-Hunt syndromes are ringing in your ear, which is the scientific term is called tinnitus, and that will also create some difficulty hearing as well. And the last symptoms would be vertigo and dizziness, and if you feel like you're experiencing this quite often along with your facial paralysis, once again, I would go back to your doctor. If it's your general practitioner, they might have to refer you to a neurologist, to an ENT doctor. But all of this needs to be ruled out, and you need to get the right meds, and need to have start working on an active plan of recovery, as it is difficult to treat. I'm going to be honest. Even for a trained professional and a physio, it takes much longer, and generally the longer it's been going on, the harder it's going to be to recover. So if you are still early on in your facial paralysis and are experiencing these symptoms, please recheck with your physician and go from there. All right, I hope that this was informative, and have a good rest of the week.